The way we're taking it seriously now, everything like that, is it just because like it's impacted everyone in the West?
Welcome to episode 4 of Gorm TV. We are a web show and creative network that dissects the social issues that affect Ireland's multicultural generation. My name is Mamobo and I have my wonderful panelists here, and this week we are going to be talking about the social impact of COVID-19. So as you know, throughout the past year, 2020 was a catastrophic year in terms of health, economics and things like that. COVID-19 came into 2020 and we were all shook. We did not know that it was going to affect us such in a way. Alongside it being a global health pandemic, it was there was a shift in the social dynamics of our society here in Ireland and globally. So I think the conversation around the social impacts of COVID-19 were not to the extent that it was around like health, finances, the economy and things like that. So with my panelists here, we're just going to discuss in terms of the social impact of COVID-19, how it has affected Irish multicultural people, how it has affected Irish youth, how it has affected people of all different backgrounds. So guys, I'm going to bring it to you here. What do you guys think of this week's question? So Tiziana, yeah?
I'm going to start if it's okay. I guess for me, I'm trying to look at the question in a holistic way. And I personally, I'm a millennial. So we are actually experiencing the second recession now because the first recession was in 2008 and now we're in another recession. So from an economic point of view, I guess the pandemic has been tough on many people because we have lost our jobs but even before that, I think for many of us, it's been difficult from an economic point of view. So many of us are part of the gig economy or we have short-term contracts. So you don't know whether you're going to get a job once your contract is over. And that can have an impact on your mental health as well. So it can be quite problematic from that point of view. And also the fact that everything had to be moved online. It's been tough because for many people that has been stressful. I think, I don't know, I know you were looking for the social point, perspective more than anything else, but it's difficult to, I guess, to separate that from anything else. And so to me, yeah, it's been challenging for young people, I guess, from an economic and mental health point of view. But then, we also have the advantage that maybe we are more used to social media and the internet than older generations. So I remember a few years ago, before the pandemic, I was at the bus stop and there was an older man and he was complaining that young people were always looking at their phone and they were always listening to music, they weren't interacting enough. So I think that's, I don't want to generalize, but in general, we use the internet and social media more even in the past. So the good thing is that it's easy enough for us to be on social media and to have conversations on social media and so on. But yeah, it's been challenging also because I guess, well, for me personally, I miss face-to-face contact sometimes. So I think that's just my opinion.
To piggyback on what Tiziana said there, we are inherently social species. The reason why in an evolutionary context human beings have survived and other species have died off is because of our social element, and that has been jeopardized greatly because of COVID-19. So the way we operated, it's almost like we've had to turn it upside down simply to survive. So I think there's somewhat of a paradox in that. I think also something that definitely struck out to me, especially when reading the question and thinking about how it's impacted us socially, is how when things were busy and fast-paced, when we were living within the conventional system in which we operate, one thing that people spoke for was a longing for peace and serenity. And it seemed as if when peace and serenity arrived, we weren't ready with everything that came with peace and serenity. Hence why so many people were struggling with their mental health and introspectively diving into the problem that they had to deal with, because when things were so busy and fast-paced, you simply didn't have the opportunity to deal with that. So paradoxically, it's almost like we're longing for an escape to what should be our escape from the conventional way of doing things. We're longing for an escape from peace, in other words. So I think this is something that is a key question that we need to consider as well. How, when peace arrived, because of the time it gave us to think about ourselves and things that we deal with, our personal challenges, our mental health, we simply were not able to confront that, simply because of the fact that when things were so fast-paced and busy, you don't have the moment to kind of contemplate and embrace the challenges that you face personally. The second thing I think I've noticed, especially when it comes to young people, is how COVID it's redefined the definition of equality. You know, when things are fast-paced and when we're dealing again in that conventional system in which we operate, it's almost like we ascribe so much privilege and status to particular jobs and to particular people within society. But COVID has indiscriminately impacted everyone. Now, if you come from a particular background, you are more prone to contacting COVID, but it's an ethnicity blind, nationality blind, class blind thing that can affect anyone. So in terms of the concept of it, because when people speak about equality, I tend to hear people talking about, it doesn't matter, we're all human beings, we're all going to end up in the grave anyways. But that message, it doesn't have a punch unless death is immediate. And COVID is so immediate to all of us. So we've had no choice but to reckon with the fact that at the end of the day, we are all equal, because we can all be impacted by this. And I'd seen us embracing a sense of community and solidarity, following the government guidelines, complying with the rules to protect ourselves and our community. The only time this really occurs is at times of war. You know, if an army goes out to battle in a war, it doesn't matter how poor you are, how rich you are, what your ethnicity is, what your race is, you're all fighting a common enemy. The common enemy that is COVID has socially unified us in some sense, because we've all had to act in a way that's based upon solidarity to combat its impact. And something that I think has been a recurring theme in our conversation thus far is activism. And I think the upsurge in activism that we've seen in the past year would not have been as effective or as expedient had it not been for the coming into being of COVID-19, because it's left us with no choice but to reckon and confront the challenges of the world that skirt society. You've seen it on your phone every day, be it the death of George Floyd in early 2020 or any other thing that we've seen. It's left us with no choice but to psychologically and philosophically confront these things. So I think it's supplemented the rising in activism that we've seen, especially online over the past year. But yeah, that's...
You know, just what Eric was saying there, in terms of war, I was actually it was just today. I think today, like you asked us earlier on, Mamobo, how are we doing? And I said, oh, I'm grand, I'm good. But today was quite a challenging day for me, I think, internally, in terms of my mental health, I would say, when I was reflecting actually on the question. And, you know, I said it to my partner and I said, God, because we both have lived, we went out to North Africa. We lived in a country in 2012 post-revolution. So we know what war is like physically. So I said to him, I said, God, I said, it feels like we're at war, but we can't see the enemy. And that is much more frightening than and has had much more of an impact on me than I realized. And then I kind of was reflecting and thinking, have I been internalizing this for the past few months? You know, internalizing, just get on with it, Sarah. You know, you've had a baby, get on with it. Focus on the baby. Focus on, you know, your life. Focus on your career. You keep going. You've got a job. And this kind of almost this type of idea of, you know, I don't want to call it toxic positivity, but look, at least I have a job. At least I'm healthy. At least I shouldn't complain. You know, and but with thinking about the question, I kind of said, well, hold on a moment. Let's revise this and let's have a look. And exactly as Eric said, you know, this fast-paced, you know, environment that we lived in pre-COVID has, you know, made us slow down and were we ready? You know, I was a planner and I knew everything. And now I'm kind of like, oh, how do we move forward? And even talking to my partner saying, look, we need to have a plan A, plan B, and plan C. with the pandemic involved in it, merge the pandemic into that, So I'm thinking about my career. I'm thinking about my daughter who hasn't yet 6 months and she has not felt the kiss of her grandparents. That's what COVID has done, and the reality of this. And like we think of, the millennials in terms of this is our second recession. A lot of people have lost, jobs. A lot of young people are the frontline kind of workers in terms of, the restaurant industry, hospitality and so on, at minimum wage, and the gig economy and so on. So it's impacted them. So it's just, there's a lot of, issues around it. And as a woman that's had a baby, when you look at the maternity services, the lack of, the neglect, I would say, to public health in terms of, the infrastructure. Why aren't we well staffed? Why are we in a crisis that, that should have, should be easy in terms of combating, because all we need is well-staffed, frontline workers. We need to have the infrastructure in place, but we neglected that for how many decades? So, we have to take it easy on ourselves as young people. In terms of just addressing the third part of your question regards stigma, we have to look after the young people in that perspective, because for decades we had abandoned important things that we should have been looking out for in terms of, public policy, and looking after our hospitals and looking after, the structures in place to ensure that we can go through this, our mental health services and so on. So we are at war and we don't have the tools to deal with it. We've got the public health advice with regards to mask wearing and social distancing and so on, but we don't have the real tools to combat this pandemic on our own, and I think it's a conversation that we do need to have, and we need to be honest. And I think politicians need to be honest about, and the experts also need to be honest about, and we need to address it. There is a golden opportunity in this pandemic to learn from what we have, what we have neglected, and start addressing it now. And that's by having those conversations and moving forward. But it's an interesting one. And I think it has impacted us immensely in a positive and in a negative way.
Definitely. Thanks, Sarah. I think it's the way that you explained it, all of you three, Tiziana, Sarah and Eric, it just shows the vastness of COVID-19. I'm sure every one of us have felt it in some way, shape or form, that this, not only is it just but a disease that has been plagued throughout the planet. It is something that has affected, whereas like Sarah, you're having had you're giving birth to your child, whether it's education, whether it's loneliness, whether it's something like that, it has affected each and every human, most humans in our society anyway, in a very distinct way. Sandrine, do you have anything to add to this conversation?
Yeah, I know. I was just going with what Eric was saying, in regards to socialization, because before COVID, yes, obviously I'm aware of society, but I don't think I was very individualistic in a sense where I was okay, I want to finish my PhD, this. I didn't really think about the society as a whole. But now with COVID, it's when it comes to what Sarah was saying, in regards to mask and everything like this, it's every mannerism and all my habits, it is to protect my fellow human beings, so it's made you slow down in a sense, and just not everything is about you in that regards, and it's where it comes really hard. So let's say when it comes to stuff like anxiety, so before there was a taboo topic with anxiety, you're oh, I'm anxious, it's get over it. But now with COVID, it's, you can't say that, because it's unexplained, I myself, I'm an extrovert and I love socializing, everything like that. And 2020, I struggled because I didn't have that, I couldn't see my friends. And for my experience, anyone else could be well, people are dying and you're just stressing about this. But that's why, for me, I was missing that social element, which brings on my anxiety, which brings on sadness and this. So it was where you had to just think of society as a whole and think about how with mental health, it impacts everyone so differently. And it is I just think with the pandemic, there's just highs and low constantly, but then it is at the end of it, it's not an individual thing, it's, you have to think about people in general, like in that regards. And I think then that's why it comes really hard then, like when you do have people like which, oh, COVID is a hoax, this and this, and you're like, but it's impacted everyone around the world. Like there's no one is immune to it. And like that's what Eric was saying. And like that's when equality came in, where it was like, do you know, I always ask myself with this question, like what would have happened, like let's say if COVID came from Africa and was just restrained in Africa, like would we have all cared? Like it, would we have all, like the way we're taking it seriously now, everything like that? Is it just because like it's impacted everyone in the West? It's impacted, even with the progress of the vaccine, would that have still been the same, like if it was only a certain group of people got it? And as Eric pointed it out, like, no, because like we are all, like with COVID, you can't see it, you can't feel it, like everyone is affected. So then it does call for like that sense of socialization and just understanding like how one's action like kind of can have like a diabolical effect on everyone else. So then like in that regards, it does call for a community and it does call for solidarity, because it is the one thing, like if I'm talking to Mamobo and she's like, oh, I'm anxious, I can be like, I'm in solidarity with you because I feel that, because I go through that. While before it was very individualistic, where like Eric could be like, oh, I'm anxious. I'd be like, why? Like what? But like now it's, I don't know, just the society that we live in now, it's kind of made it more accepting in that regards, to just understand how things are just affecting everyone at different paces and different times, and just how you just have to just take care of your fellow human being. And I just think before COVID, I know myself, like I wasn't really like aware of like I knew what was happening with society, but I didn't, like, I don't know, like with it now, like I wear a mask because I'm like, I know I don't have it, but like if the off chance if I was to give it to someone and they had a vulnerable person, like I'm very more focused now on like thinking about other people and like what my actions could have done to them. So like before, like obviously yes, I was like compassionate and caring, but I think now with COVID, it's just made me super aware. And like that's why I'm like, even like when we do get the vaccine, everything like that, like I, like for myself personally, it's changed me for the better, because I've just stopped kind of thinking everything about myself, just being like focusing on the now, and then just being like, like checking in on my friends more, like this, like these little things I took for granted because we were living in a really fast-paced world where it was like, like I want to do this, I want to do that, but now it's like, like, oh, I haven't heard from Mamobo, let me check in, because we're all indoors, we're all this. So like for me, I felt like I've grown more as a person because I've kind of had to understand socialization way more through COVID.
Definitely. Thanks, Sandrine, for that. I think it's really highlighted COVID-19. It's really highlighted the fact that people are just more self-aware. People are more empathetic as well, like you mentioned, and people are more just like thinking about others. I think in the West in general, we're very individualistic, and there's this idea that we need to do everything for ourselves. We need to get the best promotion to be for ourselves, and then things like that. And there's less of a community feeling when it comes to uplifting others and being there for others. And COVID-19 has definitely brought that solidarity between each and every member of society. I know Shane is here if he wants to add anything, but I just want to ask, Shane, do you want to add anything to this?
Yeah, I think it's a great topic, and it's it's definitely shifted society in a lot of different ways, and moved society in a progressive way as well, in many different respects. And having come from like a recruitment background and doing some studies over the last few weeks and months, it's certainly made an impact on various different classes of society. So like in particular, because in a lot of different societies, women are still primary caregivers, particularly when it comes to people in single relationships. That certainly is the case. And remote working has, because in a lot of different economies, women still work in a lot of lower paying jobs, and in kind of front facing jobs as well, where they actually have to be physically there, have definitely suffered from that kind of respect as well. And I think a lot of organizations have shifted as well in a really positive sense. So a lot of tech firms and a lot of firms that do have the potential to work from home and work flexible. There's been a huge push for that to increase diversity to support those that have these different kind of childcare needs, but also from a diversity push as well. There's been a huge push, and I think we've really moved forward. I think the pandemic has shifted society it's pushed us on in many different aspects, like 5-10 years, like remote working. It was definitely becoming something that was seen as more common, and now it's something that people have to face in a lot of different aspects. But I definitely think from a recruitment element as well, there's a huge aspect, and there's a huge push and demand from recruiters and different companies to actually push diversity forward, and particularly with the events of the Black Lives Matter campaign. That's had a huge impact globally, and it's been great to see. Obviously, there are numerous negative aspects that have happened as well, but there are definitely positives that we can take from it too. Some of the negatives, I've seen reports of, young people in particular. When you look at from an educational point of view, there was a report done by an international body whose name I can't remember, but about 65% of young people that are in education have reported less learning from having switched to a remote and socially distant a kind of way of learning. And even speaking to some people that are going through different qualifications, like one particular person who's in a similar background to Eric, has continually had exams pushed back because they have to be in a physical space, and that's had a huge impact on her from a career aspect. Her career is kind of being stalled there. But that also has a negative impact then on your mental health. It's like, I feel like I'm very much stuck, and there's kind of nothing that I can really do about it. So yeah, I definitely think it's had a huge impact on society. Some negative, but some actually really positive too. So it's good to actually focus on that too as well.
Mamobo, could I very briefly extrapolate two things from what Shane said? Yeah. Firstly, I think preceding what Shane said, we all acknowledge that COVID has brought about a sense of solidarity, and in the fact that COVID has a capacity to affect us in equal ways. But I think the caveat with that is the fact that some people are more prone to being impacted by COVID than others. So Shane pointed out how a lot of women are working in particular jobs. A lot of particular people in particular societies might be working in particular jobs also. A lot of people who are more impoverished might be in more sociable environments. So those vulnerable people within our society who are vulnerable for whatever reason are the people that we definitely need to consider during these times. And in terms of young people, it's almost as if young people have had to assume an extremely responsible role at an extremely young age. These times for many young people should be times in which they have fun, they make mistakes, and they do things that older people tell us that we should have the right to do and learn from. But it's as if we've had to neglect that opportunity entirely to embrace a solidarity that only an extremely responsible person would proactively go out to do, simply to protect ourselves and our society. So I think it's really reshaped the definition of youth in this context in these times. So that has definitely been an interesting development also. And to conclude, I think because of the fact that in the conventional system in which we operated, because of the fact that in that system, there are some things we were prone to do and prone not to do. And now we've completely had to change those things and flip them upside down. We definitely, when things are back to normal, have to think about how we can restructure the system to encompass things like these. As Sarah mentioned, war. When it comes to war, you have massive geopolitical entities like the USA and Russia and China preparing to combat with one another, when the likelihood of that happening is somewhat slim. But when something like this came, no one was prepared for it, and it impacted us in such great ways. So we really need to think about the likelihood of things like these arising and protecting the most vulnerable people within our society if and when they do.
Definitely. And I was just thinking of when you were talking about how it's changed the perception of how we see young people. I know myself that I teach first year students in classes and stuff, and now everything is online. And I just commend them a lot, because like when I was in first year of college, I couldn't even dream of doing things like this, or online learning, being at home, not being able to see your friends, and the impact that has on your mental health. So in terms of the people, especially leaving cert as well, and people in universities, I really commend the work that they're trying to do, and everyone that's trying to work online and things like that, because this whole shift in learning, working, just living normal life is completely upside down. And just society, the way we're spreading that solidarity with each other is great. It's really great to see. Sarah, were you going to say something?
I was just going to say that it has shifted our priorities into a more of a kind of collective collective action, working together kind of thing. But we are going to get these type of disruptions. We have a huge, the climate. There's going to be a climate crisis heading our way, and that's going to create a huge disruption to everything we do. Even our technological advances are going to be impacted. Maybe working online is going to be difficult, and we have to get ready for that. And again, I can't emphasize, COVID has one thing that has taught me is that we need to ensure that policies are in place that give people access to healthcare, that give people access to education, and that ensure the safety of the most vulnerable, and hear their voices. And I don't know, I just feel like a bit of a broken record with my colleagues and my friends, that it's something that we need to get right now, because if we don't get it right, we're going to see, like the US saw 400,000 people dead. How many people have lost lives here in Ireland? It's crazy to think the other night 56 families have been impacted by this. We're going to see greater disruptions. The only thing to prepare us, and those tools again, are public policies to ensure that they're there. And that will take a lot more activism, a lot more, movement on the ground to push for this. And I just, like you said, a broken record, we have to do this right. It's our golden opportunity, because, we can't underestimate how impacted we have all. It has impacted us all,
Definitely. And I do agree with you there that there needs to be a change now in terms of public policy and the infrastructure that is built, that we're trying to live on, but needs improvement in the future. Because if we don't do that now, we could be following other countries in terms of their death rates and in terms of how it has impacted their society. So that what we're doing now in these conversations is really great in terms of building that dialogue and that discourse, and particularly amongst people of our age group, because definitely the people that, in my opinion, when I see it, the people that are making the policies, or the people that are in charge of these policies, let's say, they don't look like you or me, or they're not they're not the same age as you or me. So how could we relate to them? But definitely it's great to see people of our demographic having these type of conversations and bringing them out there to the world. So that's amazing. So just on a final note, we're coming up on 30 minutes now. Just, does anyone have any final touches that they want to add with the conversation? Tiziana, yes?
I just agree with Sarah about public policies. So another example is that here in Dublin, in the last few years, we have been building a lot of mainly hotels and offices. And now because of COVID, they're actually basically empty. And they haven't really focused enough on building houses, especially affordable houses. So, you're wondering about the wisdom of that, short-sighted attitudes that people in policy have had for so long. And yeah, I think, again, hopefully this pandemic will be over soon, but there may be another pandemic in the future. So if you don't have a good health service, then you're going to be in trouble. And yeah, so I agree with Sarah that it's really, we need a shift in priorities. And it's not just about young people, it's about the entire society. And yeah, so that's what I wanted to say.
Definitely. Thanks a million. Sandrine?
Can I just add on to just build on to what Eric was saying, like in regards to young people. And I just think, like, in the news, anytime like when there's a spike, it's always like, oh, you know, vulnerable age group, and we always like the straight away that's assumed with the older generation. There's never like, there's no focus on like the younger generation, you know, and like as Erica was saying, like they're the ones which are like in the front line, like all like my friends or like even my sister's age group, like they're the ones which are working in Tesco, they're the ones which are like in restaurants and stuff like that. So then again, like with what I was talking about earlier, like with taboo topics like mental health, like that has always existed, but then it is kind of more prominent within our age group. Like when like things like anxiety and all this, like with my parents' age group, like they'd be like, what is that? But in ours, like we know it. So then like when it does come to even just the way media, anything like it's portrayed, like young people are just seen as, it's like, you know, like vulnerable age group, and then it's like the rest. But then it's like you do kind of have to look at the way, as even Mamobo, you were saying, you know, like when, yeah, like if I was to think about like by being back in first at like 19, 18, like it is just a time of like having fun, this, and now you're literally putting that responsibility in someone being like, if you're working like what used to be a part-time job just to make money for a night out is now like you're the frontline worker, and if you don't follow this, you're going to make someone else sick. Like that is immense responsibility that we are putting on young people, and like the credit isn't there. Do you know, as I said, like when you are looking at the way the reports are, even the last time when it was I think it was yesterday when they were kind of reporting like, oh, we might be in level 5 for like the first 6 months, and straight away it was like, oh, it was all the Christmas, it was everyone over Christmas, it was all the young people, and I was like, no, but like where's the fact of that? You know, it wasn't, it was people meeting, and I was like, there's no age group there. But then again, as I say, like just in the media, there's no credit to being like, you know, within the front sector, like with hotels, this it is young people which are there, like they are there, and then you are asking them, like even with online learning, to be like, college is supposed to be like 4 years of like, yes, it's educational, but it's also like socializing process, like when you are meeting, so you're asking them to halt that. So by the time like this pandemic, like the meaning of youth and vulnerable, like that has definitely changed. And I just think there's, when it comes to youth or millennial, there's just like a negative connotation put on that, as opposed to like looking at it and being like, we have asked them to grow up too quick. Like I could never imagine like have like with now, like with the PhD, like I'm finding it tough, but I'm like, I already have my degree. So I'm like, imagine someone starting out and online is all they know. Like I've already established my friends from when I was in college, you know? So it's like, what if it's someone like in Mayo, Carlo, anything like that, and like they've never seen anyone in their class and anything like that. And it's like, even if things do go back to normal, like as what everyone was saying, like there is going to be like, I will need to kind of like adapt to the new way of living. But I just think there is a need definitely to just rethink of the word like vulnerable age group and the new definition of youth, because it's like youth is just very like, you know, like just joyful this, but like I think COVID has definitely exposed that, and there isn't enough credit paid to the young people, which are the front lines in regards to that.
And in terms of terminology, like you spoke there of how so many young people occupy frontline worker roles. You know, a long time ago, not too long ago, actually, we didn't refer to these people as frontline workers. It's almost like we're using vocabulary of significance to now describe people that we're relying on within our society, when we should have seen these people as significant all along. It's like when we were pushed to the brink that COVID brought us to, that's when all of these very important revelations started to occur. The need for some community, the need for empathy, for solidarity, the need to understand that people who occupy particular jobs are people that we rely on. And we should not only place significance and ascribe privilege to what they're doing, or ascribe significance to what they're doing when we need them most, but instead we should see them as important irregardless. So I think a lot of revelations has occurred, as Shane said, and moving forward, we need to use what we've learned to restructure with policy, as Sarah said, the society that we live in.
I think one thing to just to point as well, that the social impact of COVID has also made us much more empathetic, but has also made us, you know, quite flexible. We've learned to adapt to different scenarios, lockdown 3, lockdown 5, lockdown, you know, all these levels and different type of levels, and, you know, levels within levels. But, you know, that what I've noticed throughout the last like year, it's almost a year, I can't believe it, that we've, you know, been going up and down with this pandemic, is that kindness. kindness has come through a lot. We have been so kind with each other, people that we haven't met in real life, that we've met virtually, that we've, you know, people have been walking, you know, the elderly dog, you know, the dogs of elderly neighbors, you know, helping people with their shopping and so on. So that kind of collective community has brought out a much more kinder community and society. And I hope we take that forward and we keep going with that, because and to be honest as well, everybody has contributed to that, but I've seen it a lot with our generation, Gen Z and the millennials, you know, and it's a great thing, and I'm going to boast that we're super kind people.
Thanks a million, Sarah, and thanks guys to the rest of you. I think I want to end on that note, because that's a really nice positive note, that we as a generation, both Gen Zs and millennials and everyone, COVID impacts everyone, but we as a generation have put ourselves forward as being, whether you're frontline workers, whether you're in your university studying, this generation has actually embodied that solidarity and kindness in terms of their own activism, because 2020 was, in my opinion, a huge year of activism as well. But the impact of COVID-19, both socially, economically, physically, mentally, has been a roller coaster for the entire world, and in Ireland too. And this year, like Sarah said, and COVID-19, like Sarah said, was a year that we just saw a great amount of kindness with each other, and that's a beautiful thing to see. Will it last? We'll just have to find out. Fingers crossed. So thanks a million, guys, for having the conversation once again. Hi guys, thank you so much for watching. So did COVID impact your life? We'd love to hear your thoughts below down in the comments. And do like and subscribe if you enjoyed the video or want to see more. As this project is supported by Dublin Theatre Festival, make sure to stay tuned for live interactive performances that dissect the explosion of social consciousness here in Ireland. And follow us on social media if you want to join the conversation and see what we're doing online. Thanks a million for watching. Bye bye.